We'll go ahead and call the meeting to order. Welcome, everybody. What a great turnout. If you'd please rise and join me for the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Again, thank you all for being here. We have this morning, right off, first thing is our National Breast Cancer Awareness Month proclamation. So I want to first welcome those that are here for that. For nearly 4 decades, the United States has recognized October as National Breast Cancer Awareness Month. It's been an annual devoted to education everyone about breast cancer. So using this time to make sure people are aware of the importance of early detection and making sure that we all have access to timely and high quality health care. This year we celebrate the nation's theme, every story is unique, every journey matters. Breast cancer is most commonly diagnosed cancer among women worldwide. In 2022, approximately 2.3 million women were diagnosed and another 670,000 died from the disease. These are not just numbers. These are mothers, sisters, daughters, and friends that deserve hope and dignity. I'm going to have Commissioner Boyce read the proclamation. We're going to present some certificates. We do have we're going to do some photos and stuff. Tamara will help us with that. And then we're going to have some time to have people come up and explain what their organization does and how they support the community over the issues that we're going to talk about today. So I think I'll have Commissioner Boyce go ahead and read the proclamation, please.
So this is the National Breast Cancer Awareness Month of October 2025 proclamation. Whereas October is National Breast Cancer Awareness Month, an annual campaign to increase awareness about this devastating disease. And whereas today there are more than 4 million breast cancer survivors in America, however, hundreds of thousands more will be diagnosed this year alone, facing a diagnosis that is often frightening and overwhelming. And whereas during National Breast Cancer Awareness Month, we honor the memories of all those lost to breast cancer while we extend strength and support to their families, caregivers, survivors, and those currently undergoing treatment. And whereas breast cancer remains one of the most common cancers affecting women worldwide, with over 2 million new cases diagnosed each year, and countless families impacted by its emotional and physical toll. And whereas we also express our deepest gratitude to the dedicated medical professionals and healthcare researchers who work tirelessly to improve prevention, detection, and treatment with the goal of ending cancer as we know it. And whereas advances in early detection, treatment, and research have led to a significant decline in mortality rates, yet continued awareness, education, and support are essential to further reduce the burden of this disease. And whereas we know that for millions of families, cancer is deeply personal, too many Americans know the pain of losing a mother, sister, wife, daughter, or loved one to breast cancer. And whereas we know that resources and support are available for those seeking information about breast cancer locally through various healthcare organizations, hospitals, urgent care facilities, community service groups, public health, and healthcare providers, as well as through the National Cancer Institute and the Centers for Disease Control and Prevention's Early Detection Program. And whereas National Breast Cancer Awareness Month provides an important opportunity for all Americans to reaffirm their dedication to supporting individuals impacted by breast cancer and to come together in a collective effort to eradicate this disease and improve lives. And now therefore, we, the Douglas County Board of Commissioners, do hereby proclaim October 2025 as National Breast Cancer Awareness Month in Douglas County and encourage all Douglas County citizens to participate in educational events, screenings, fundraising initiatives, and community programs that promote breast health and support ongoing breast cancer research. Let us also commit to doing our part to provide more support, hope, and care for patients, families, and survivors of breast cancer.
Thank you very much. Give me just a minute, I'll work my way around here.
Presentation of certificates. All right, so of our invited guests, I'm gonna just call the ones that I invited, and if you're not on this list, we'll get you up here too. So let's start with Douglas County Cancer Services. So if you are a board member or with that, then please come up. So that's all of us.
Yeah, everybody.
All, yeah. So all of you associated with it, we want you all up here for the picture. And if you haven't signed the clipboard and you came in late, you can pass it over here. Thank you. That's all signed.
Stand here
So we'll
somehow
have
and
you
take a
guys
picture.
stand on each side of Commissioner Freeman.
Split the difference here. There we
Sideways,
go.
probably.
And show your certificates for us. Oh, yours is upside down. Oh, no, it's, oh, it's not, no, okay, no, it's me,
She has it
sorry.
right.
I have to look.
Just me.
So we'll look right up here, ready? Smile. A couple with my phone. Okay. Sorry. Look up here, ready? Smile.
As backups.
Yes, I do. Alright, thank you.
All right, the Community Cancer Center.
Stand by yourself and I'll just read my name.
Give it back.
I'm doing pictures.
We'll send you a picture.
Tamara will send you photos.
Man, I worked that one hard too.
Okay, smile. Great. Okay.
Also wanna
So right
note here that not only is Commissioner Freeman, commissioner in this sense of giving this certificate out, he's also on the
Thank
board with Community Cancer Center.
Yes.
CHI Mercy Medical Center. Let's see, Roseburg VA. Oh.
Thank you.
Just need to tell Tracy to.
I know, huh?
Smile. Ready? Up here. Smile. Perfect. Thank you.
All right, anyone here from Aviva Health? Umpqua Health? Lower Umpqua Hospital in Reedsport? DPHN? Public Health? Yep. And then we have our survivors. Anyone that's a cancer survivor, we would love to have a picture with you, Commissioner.
Are they here? So OHSU.
Yeah, OHSU, yes, so next on my list.
That's fantastic. Just right up here. Smile. Open my phone. Not done yet. Okay, ready? Smile. Thank you.
All right, OHSU education.
Nice to see you.
Ready? Smile. Okay, it's right here.
So many.
Alright, thank you.
We just wanna make sure there's no. I do not, so I actually live here locally
you do?
and serve
Okay.
locally for Douglas County for
Did I
OHSU as the
miss
cancer
anybody?
Yeah, so
specialist.
Julie was up in the presence office. She worked for me for a while.
Oh, awesome, excellent.
Tamara.
There's some. Oh, sorry, who did I forget? Oh, Evergreen, yes, sorry. Yes.
Perfect.
The other side is done.
The girls against the boys. Oh, yeah. Yep, it's right up here. Smile. Okay, couple with my phone. Okay, ready? Smile. All right, thank you.
All right. Thank you for coming.
So do one more roll call before I try to walk off again.
No,
Anybody else?
Not yet, not yet, not yet. Now we want everybody else.
Oh, okay.
Yeah, no, Sam.
Go right back up.
It's a big group photo.
Group photo.
Yeah. And we can have some folks stand up with Commissioner Boyce at the top.
Nikki's like, yep, that's me.
Good, how are you? This side.
Oh, good, Ruth is tall.
So if you can't see my
You're
face,
tall.
then the camera can't see yours.
Come on in here.
You can. Right up here, ready? Smile. A couple of my phone. Ready? Wow. Perfect, thank you.
Would you like you one in the middle? Sure. We got room for you too.
Okay, wait,
One more quick one, there we go.
Really quick. Alright, 3, 2, 1. There we go.
I know, she gives me lots of options.
no, that's Commissioner Freeman's.
I'm happy to share.
Alrighty.
All right, so I guess I'm gonna invite some folks up to talk a little bit about their program and what they do here in the community. So I wanna start with the Community Cancer Center. As Tamara said, I've had the pleasure of being on the board of directors at the Cancer Center for a while now. And I've watched the amazing work that our local center provides, services they provide. And I joined the board at a time that the new building had just been built. One of my best friends was running the facility, who has since retired, and I've watched sort of the incredible evolution of them working with partnerships with OHSU and other groups to make sure we're providing state-of-the-art care, regardless of the ability to pay, which is an amazing task in this age of healthcare. So, Tammy, you got a few things you'd like to say, and we sure appreciate your work. Tammy's the executive director at the Cancer Center and has been for a while now.
Yeah, 10 years now,
Yeah.
time flies. Well, good morning, commissioners. On behalf of the Community Cancer Center, I wanted to extend our heartfelt thanks for all your unwavering support. Your contributions through community networking, aiding and securing campus tenant occupancy, and in financially backing our fundraising efforts have been instrumental in strengthening our long-term sustainability. Your commitment to our mission empowers us to continue providing compassionate, life-saving care to those who are in need. Thank you for being true partners in our journey. You guys have been amazing supporters throughout the years that I've been there, and I've been there for 26 years, and I just want to thank you.
Tammy, thank you for the work you guys do, and I have to also mention my wife works with you there at the Cancer Center. She's here today with us, and not only do I appreciate the work you all do all the time, I get to hear about it quite often also. So I'm very impressed with it, so thank you very much. Let's have the VAs here, and I think we'll talk a little bit about women's healthcare through the VA and things that have sort of advanced over the last 20 or 25 years. Been pretty amazing, the VA taking on more and more.
Yes, I am here representing the women's health program, so I definitely don't have as much information as Jessica probably would, but yeah, they have made huge improvements and expansions. We have a dedicated space now up in our Eugene clinic. The program down here in Roseburg has definitely added more staff. We're working on that. Just more programs, more services, more aspects of women's health. So we're just really happy to be able to provide those services and help contribute to all women and their healthcare, so.
Thank you, and thank the folks you work with. The VA hospital, the VA services are very important here in our county. Taking care of our veterans is really important work.
Part of a great team, so
Thank you.
yes.
And Evergreen, it's nice to have folks from Evergreen. You got, come up and say a few words about some of the work you do there?
Good morning. On behalf of Evergreen Family Medicine, my name is Cynthia Narunia. I'm a National Board Certified Health and Wellness Coach and a Community Health Worker for Evergreen Family Medicine. And we'd like to thank you for this proclamation and recognizing the work that all these fine agencies and others do to support patients and families in our communities. Evergreen Family Medicine was able to secure its own mammography screening equipment in June of 2024, which has been a great asset for the community and also helped with Mercy outpatient imaging to kind of carry that load and helped people be able to get screened a little bit sooner. And since then, we instituted a cancer support group and we started a new, we invited community partners last May to join us in a community cancer conversation. And that was in partnership with Sarah Swanson and OHSU. And then we arranged a picnic in the park for our patients and families. And so we now are going to adopt those as annual events. And so again, we thank you and all our community partners for their amazing support to help patients in our community.
Well, thank you for the work you're doing.
Thank you.
Oregon Health Science University. When I was in the legislature, I worked a lot with Oregon Health Science University, so much so that they stole my chief of staff. She continues to work for them up.
Thank you for having me here today. My name is Sarah Swanson. I'm the OHSU Community Cancer Control Specialist serving the South Coast, so Coos, Curry, Douglas, Jackson, and Josephine County, working to implement projects related to the Comprehensive Cancer Control Plan for the state of Oregon, which is a collaborative effort between the Knight Cancer Institute and the Oregon Health Authority. That collaborative has identified 5 priority cancer areas for the state of Oregon that show disparity, especially in our rural communities, and breast cancer is one of those priority areas. Particularly here in Douglas County, we see more than 44% of breast cancer cases diagnosed in a later stage, which indicates that our rural communities and populations might not always have access to screening that's readily available or that they can get to via both transportation or other access programs that may limit that access and that care pathway. OHSU is committed to quality patient care and advancing research across the cancer care continuum, and especially in our rural communities. So far this year, we've engaged in several community cancer conversations about prevention and screening, both the one just highlighted by Cynthia with Evergreen. We were just in Elkton last week for a community cancer conversation on prevention and screening, and we'll be in Reedsport 2 weeks from now to have another one of those community cancer conversations. I'm also spearheading a South Coast Cancer Task Force, which we invite anyone who is interested in addressing cancer disparity here in Douglas County, Coos, and Curry to really see how our region can come together and address these challenges to cancer access of care for patients and how our communities themselves can become more cancer resilient. So we appreciate your proclamation, your county's commitment to cancer education and awareness for your population, and we look forward to how we can work together to address those disparities in this community and make sure we're all healthy moving forward. Thank you. Thank you.
Again, thank you and thank OHSU. When I was in the legislature, the whole challenge grant came up from Phil Knight. Phil and his wife had set a challenge forward of they would donate $500 million if there could be a match.
Yes.
I happened to be co-chairing the subcommittee of Ways and Means for Health and Human Services and was known and continued known to be pretty tight with the public dollar.
Yes.
And I remember them coming in to talk to me about it. And before they even got the question out, my response was yes. And it kind of threw them. They kept sort of their pitch, and I'm like, you're already yes, you're working towards a no? Eventually, the legislature was able to participate in that grant match at $200 million. So we were, as a legislature, able to help a significant amount with getting what turned out to be the first $1 billion together to build the Knight Cancer Institute.
And they've recently given us another $2 billion
Yep.
to the Knight Cancer Institute to create the Knight Cancer Group, which will be its own governing body outside of OHSU with a real focus on that patient navigation and care. And they have a real commitment to ensuring that care reaches our rural communities through our cancer specialists.
It's amazing, to be there kind of at the beginning and then watch the evolution through time. They're doing amazing work there, so thank you. We have the Community Cancer, Douglas Cancer Service, Douglas County Cancer Services folks here too.
Douglas County Cancer.
I got it, I finally got it, Douglas County Cancer
A
Services.
lot of people think it's a county program and, but it is not, but I wanna thank you on behalf of Douglas County Cancer Services, the executive director and our board and our volunteers to be here today and for the proclamation. Douglas County Cancer Services started in 1989 with 2 nurses from the VA out of the trunk of their car with wigs that were donated for breast cancer patients who had lost their hair. And so now we've evolved since then. We have an office on the 2nd floor in the Cancer Center, thanks to the Community Cancer Center and the support from them. One of our biggest fundraisers, and we do operate all on donations and grants and volunteers, is in October at Seven Feathers. It's a tea and fashion show honoring breast cancer survivors. The fashion show, our models are breast cancer survivors. And during the event, when they're walking on the catwalk, one of the catwalks is their bio that they've recorded themselves along with a PowerPoint presentation along with their journey. So it is just a very enlightening, heartwarming, but also at the same time, we're sold out with 400 people. And so those 400 are learning about cancer, breast cancer, and the preventions and what we can do to help each other and early detection. So that event is coming up October 19th again this year. It's our 25th, our silver anniversary event. One of the other things, and speaking along with Sarah and the Knight Cancer Institute, we did get a grant and we are working to also to find out, for the rural, what are some of the issues and what are some of the things that we as Douglas County Cancer Services can help with patients. We do provide gas cards for transportation. Sarah mentioned transportation is a big issue for rural. We provide food cards if they can't afford food while they're undergoing treatment. Maybe they can't afford rent or their house payments. So many other financial things that we provide support for. And this breast cancer event is one of our biggest fundraisers throughout the year. We also determine that there's children who have cancer. Where do they go? They have to travel either to Portland or south. So we did get a Mercy Common Spirit grant from the Mercy Foundation, and we're working very hard on reaching out to families that have children with cancer and what are those needs and the roadblocks for them getting treatment. And with this grant, we're able to provide transportation costs and food and lodging for the families when they have to travel for their child to get treatment. So again, I want to thank you for today for allowing us to talk about Douglas County Cancer Services. And I did bring a little flyer for our event if you need this for
Thank you.
for your
Is it sold out?
it's sold out, 400 tickets. So
I
we have been sold out. the
I've
last
attended that
couple of
event
years.
before and all those things you said are right, but it's also inspiring to see the story of these women going through this journey and how resilient and, they come out the other end. It's heart, kind of heartwarming, heartbreaking at times, but pretty amazing to see that journey and that resiliency in women, so I appreciate it. Anybody else? Did I miss any other groups that are here? So again, thank you all. We appreciate you taking the time to come today and allow us to do this proclamation. Appreciate the work you do every day in our community. And it is some of the most important work that's out there. So with that, we can take a little break if folks want to leave. We have a few of our regular agenda items to go through, but I know a lot of you need to get back to taking care of folks that have cancer. So thank you all for being here.
Thank you.
You guys both, I love my mother-in-law last year.
Make sure.
Getting sharpened? All right, well, we're gonna go ahead with the agenda now. So the next agenda item was a proposal bid opening, and my understanding is we're not ready for that one. So we'll skip that and we'll move to agenda item number 3, which is our consent agenda. Just a couple routine items, and I'll go ahead and move to approve the consent agenda.
And I'll second.
A motion, a second. Questions or comments? Seeing none, I'll call the question. Commissioner Boyce?
Aye.
Chair votes aye and the motion passes. Agenda item number 4 is citizens' questions. Anybody online?
Nobody.
Anybody here in the room that would like to come forward?
Last week, there was a food services contract that was approved through the county sheriff, for the county sheriff. It was
Excuse me, can we start with your name first?
Oh, I'm sorry. Yeah, it's Andrew Rosales, and I'm just a citizen today. Last week, there was a contract approved for a food services handling through the sheriff's department. It was, and I want to make sure I'm correct here, it was approved on the day that the contract was meant to be implemented. And what I'm really concerned about is there doesn't seem to be the oversight to ensure that we're getting the return on investment. There was no discussion on the final price as compared to some of the others that were submitted to bid. There's no discussion on terms and conditions, no discussions of conflict of interest, no discussion on how that fits into the current budget that was approved. Was it above or was it below what we were estimating, or are we still good there? And then there was no discussion about assumptions. The discussion about assumptions is really kind of going back to the discussion of the lumber sale. There was a little bit of a conversation about miles of road that needed to be built. There's no discussion about what were you assuming was the length of that so that each contractor could bid to the same narrative. So what I'm asking for is that we're a little more robust in our oversight before we approve contracts so that we can ensure the citizens are getting the proper return on investment.
Thank you. Who else would like to come forward? Seeing none, I will move to agenda item number 5 as a management and finance item. And I'll invite up our finance director, Dan Wilson.
Morning, Commissioners. Dan Wilson, Management and Finance. This is a grant agreement between Douglas County and the Oregon Housing and Community Services Department through their peer program. This is what we call a pass-through grant that we are administrating for the city of Oakland for them to upgrade their sanitary sewer plant, which was damaged during the wildfires back in 2020. The grant is in the amount of $1,386,669.75.
Move to approve the grant agreement.
And I'll second that. And I do want to clarify the sewer plant itself wasn't damaged. It's the runoff that's coming through the sewer plant that's damaging the inside of the plant. We have several water plants for domestic water here in Douglas County that's being affected by these massive fires. You know, the whole concept that, you know, by not harvesting timber and managing our forest somehow it creates clean water is really backfiring because, you know, if you can imagine if the water, you know, all the way from the Archie Creek fire to Oakland is still dirty when it gets to Oakland, what that's doing to wildlife population, fish and other things, that they've literally had to upgrade their system. Same situation in Glide and Canyonville's dealt with it also. So this is an attempt to help upgrade that system to deal with what's gonna be runoff from that fire for, decades. So anyway, it is a pass-through grant, but the summary's a little bit, well, like I say, they didn't actually burn the plant. It's the
It's the effects of the fire, yeah.
it's the runoff and the material that's in the water that's causing the problem. So any further questions or comments? We have a motion and a second. I'll call the question. Commissioner Boyce?
Aye.
Chair votes aye, and the motion passes. Thank you, Dan. Agenda item number 6 is a museum item, and we have James Davis, our museum director, here today with us. Good morning.
Good morning, thanks for having me. So I'm James Davis with the museum, and I guess we will be entering into a contract for our third leg of ropes at the museum, and it will be administered by the facilities department. I'm new to all of this, so I don't really know what.
Yeah, and we've been doing this in stages, just as
Stages.
funding's
This is the
available.
third year, yes.
Yeah, as great as the museum is, it has a lot of roof.
It's a lot. It is.
And some of it's flat, which is not
Yes.
necessarily the
This should be
style of
to
roofing here in Douglas
finish our
County.
peaked roofs,
Yeah,
so.
so, anyway,
I just move to approve the contract.
okay, we have a motion, and a second. Questions or comments?
I'm familiar with the roofing company. We use them in the Justice Building also, and they did a fantastic job for us.
Seeing no further questions or comments, I'll call the question. Commissioner Boyce?
Aye.
Chair votes aye and the motion passes. Thank you very much. Agenda item number 7, commissioner comments.
None for me today.
Nothing for me either, so thank you all for being here. Meeting adjourned.